By the year 2050, the elderly population in the United States will close to double in number, with those aged 65 and older consisting of nearly 84 million people. Along with the aging baby boomer generation will be an increasing need for more home health care workers. Despite this growing demand, many home care workers struggle to secure even a living wage, being exempt from minimum wage laws in the U.S. Worker advocates had been hopeful that the U.S. Labor Department would pave the way for better wages and worker protections, but last month all hopes were dashed. To the dismay of close to 2 million home health care workers in this country, Federal District Court Judge Richard Leon struck down a regulation that would have extended U.S. minimum wage and overtime pay laws to these workers. One of the greatest advocates for caregivers is Ai-jen Poo. She received national recognition in 2014 when she was named a MacArthur Genius. In 2012, she was included in Time magazine's 100 Most Influential People in the World. She's the director of the National Domestic Workers Alliance and has championed for domestic workers' rights for many years. Her new book, The Age of Dignity, Preparing for the Elder Boom in a Changing America, articulates the growing importance of at-home caregivers and how we can meet coming demand. She now joins me in studio. Welcome to Uprising, Ai-jen Poo.
Thank you. It's great to be with you.
Thanks so much for joining us. Well, first, whenever people think about the specter of having to institutionalize their own parents or grandparents, or even if they have the foresight to think about how they themselves, in several decades might end up, it's frightening. It's frightening to think about sending your parents or grandparents off to a nursing home. But most of us can't afford home healthcare workers either, and those that are available are very poorly paid. And so all around, it's just a terrible setup and situation.
It is. It's a situation that has come into being because we've never actually accounted for the work that goes into supporting families and caring for families across generations. The U.S. is one of the few countries that doesn't have any social programs in place for long-term care comprehensively.
I mean, we have Social Security and we have Medicare for the elderly to have them some level of income and health care, but you're saying that there's no actual system in place for home health care.
Or really any form of long-term care. So if you're very wealthy, you might be able to afford long-term care insurance. And even that doesn't necessarily cover what you need when you need it. And if you're very poor, you might be eligible for Medicaid, but that is a very institution-based model, nursing home-based model, and it also doesn't meet the full range of needs that people with disabilities and our elders have. And then there are millions of people in between for whom neither of those options actually work. And so we just don't have a solution for the long-term care needs for the future. We don't have a plan. And what that means is because by 2050, 27 million Americans will need some form of long-term care assistance. Not having a plan is actually one of the biggest challenges of our time. We think that that's actually a huge opportunity. It's an opportunity to put into place the systems and supports we need and frankly have needed for a very long time. But now we have no choice but to actually figure it out. And the way we need to do it is with bringing workers and seniors and consumers and families together so that we can make sure that no one gets left behind and no one's dignity is compromised in the process.